Hey everyone, we are going to start with the brush up again. So you are going to see some brush up. This is actually 3, and here you are going to discuss some head and neck questions. So we have discussed few in the morning. We started at around 10 o'clock, and then there was brush up 2. So we'll continue from where we left. So we did from 13 to 26 at that time. And now we are going to start from 27th question and go on up to the 39th question. Okay. So here most of the questions are the ones which says pick the incorrect one or pick the odd one out. So it is going to be little, mind game type, because you have to pick the one which does not belong. And usually that is not the tendency that we people have. So, but still we'll try to pick the right answer. All right. So let me just quickly send it. So here we have. Okay. So now first one, 27th one, let's see what is the answer for this. Which of the following statement is incorrect? You have to pick the statement that is incorrect, okay? So now here, the parathyroid glands, we are talking about parathyroid glands. It is not the thyroid. You remember parathyroid has the 2 superior ones and 2 inferior ones. It's pair. So altogether 4 parathyroid glands. And sometimes there could be more than 4 also. But remember, the superior parathyroid are from the pouch. You have the 3rd and the 4th pouch. So this is from the 3rd one, and this is from the 4th one, and this is from the 3rd one. Okay, 3rd pouch. So that is the development of parathyroid glands from the 3rd pouch and 4th pouch. This is 4th. Okay, so now here we have which of the following statements is incorrect? So that was little extra information. And now we are coming to the actual question. Which of the following statement is incorrect? Now, it may vary from 2 to 6 in number. I just mentioned that, yes, it is possibility. So it could vary. That is correct statement. And next one, they have distinct lobules. Do they have lobules? It is so small. You think it has separate lobules? I don't think so. There is no lobule. So let's keep this as a question mark. Is that really are essential to life? Of course, because what is the function of parathyroid? To secrete parathormone. It is important. Okay, so it maintains the blood calcium level. Blood calcium level. So we need this. They are pinkish yellow or brownish yellow. That is also true. That is a color. Each measure about 6 millimeter in greatest diameter. Yes, that is as small as that. So all these are true except for one which is completely incorrect. So we don't agree with this. They have distinct lobules. So this is incorrect. So the B is incorrect one. All right, next one, let's go to the 28th one. Let's see what we have here. 28th one says, let me just zoom it even more so that you can see it properly. Which of the following statements is incorrect again? So we have to pick the incorrect one. Regarding the vagus nerve, remember vagus nerve is present in the carotid sheath as well. It is also, very closely associated with the other structures in the neck. Let's talk about vagus. We'll see what statement is incorrect first. So now here it contains the fibers which supply all muscles of the soft palate. So now what are the muscles of the soft palate first of all? The first statement itself seems to be wrong. It is not all the muscles. What are the muscles of the soft palate? We have 5 muscles. We have palatoglossus, palatopharyngeus. We have musculus uvulae, and then we have levator valley palatini and tensor valley palatini. So all these are the muscles. Out of this, all these palatoglossus, pharyngeus, all these are the muscles supplied by the pharyngeal plexus, except one, that is tensor valley palatini. This has the different nerve supply. What is the nerve supply of this? This is nerve to mylohyoid. They're all supplied spinal accessory, which also forms the plexus, spinal accessory. Okay, plexus, it forms along with the other nerves. You have 9th and 10th cranial nerve. Together they form plexus, the pharyngeal plexus that supplies the rest of the muscles. So now here the first itself is wrong. And so this one, the tensor valley palatini is not supplied by vagus at all. So here we'll pick this out first. It is A actually the answer. And before we move on, let's try to justify why we didn't pick the others. It conveys motor fibers for the larynx. Motor fibers for the larynx. Yes. And it is predominantly afferent. That's also correct. It contains fibers which supply palatoglossus. Palatoglossus, palatopharyngeus, we have already checked it. It contains fibers from the accessory also. Yes, because that is what forms the pharyngeal plexus. So this is also correct. All the statements are correct except for one, that is the A option. So A option is incorrect. It doesn't hold good here. Okay, so that is the answer. All right, let's move to the next one. Let's see. Which of the following statements is incorrect here? The facial nerve. So facial nerve is the keyword. In this, we have to pick which one is incorrect. Now, facial nerve supplies muscles of facial expression. We all know that it supplies. So this is the correct statement. It supplies buccinator. Yes, it supplies. Gives off greater petrosal nerve. Yes, that is the first branch, greater petrosal. This is the first branch. Okay, so that is correct. What about it contains taste fibers? That is through chorda tympani. So that is also correct. Buccinated through buccal branch. That is also correct. Then the last one says it contains fibers destined for ciliary ganglion. No, ciliary ganglion, what fibers go to ciliary ganglion? You have short ciliary nerves. Okay, short ciliary nerves, they are the ones which carry those postganglionic fibers. So facial nerve doesn't send any communicating branch. So this is the wrong statement. E is the answer. It is incorrect statement. Incorrect statement is this one. So let's move to the next one. 29th is completed. Let's go to the 30th and see what is the question. The question says, in the infratemporal fossa, okay, may be found all but one of the following. So all are correct, but one is not part of the infratemporal fossa. So you have to always register the keyword that is given. So first register the keyword infratemporal fossa in your heads. Just see what they're asking you first. Just don't jump into conclusion that you have to pick this. Just find out what is the question are demanding. All but one. So they say that in the infratemporal fossa, everything is there except one thing. What is that one thing that is not there? We have to pick. So one thing that is not there. So you have to pick the odd one out. So otic ganglion, is it there? Is it there? Otic ganglion. It's there. Plexus of veins, yes, pterygoid plexus of veins is present. Which is the plexus of veins? Pterygoid. Then part of the nervus spinosus is there. It's the branch from mandibular. So that is there. Then two roots of zygomaticotemporal nerve. Two roots of zygomaticotemporal nerve. So that is not there in the infratemporal fossa. See, only when you remove the zygomatic bone, then only you can see the infratemporal fossa, right? That zygomatic bone below zygomatic bone is infratemporal fossa, below this bone. It's not above that. So anything above that and over it is not part of infratemporal fossa. So the answer here would be the D. So D is the answer. But let's check the E also to confirm it. Part of the middle meningeal artery. So there is this auriculotemporal nerve that forms a nice loop, and the middle meningeal artery passes through the loop, and that's why it is also part of the infratemporal fossa. So all these are part except for D, which is incorrect one. We have to opt that out. So that is not a part of infratemporal fossa. Okay. Next, let's see what we have in the 31st question. So 31st question, let me just not overshoot it. Okay, so each of the following structures traverses the substance of the parotid gland except. So now here, each of the following structures traverses the substance of the parotid gland except. We have to see which one does not pass through the parotid gland or it's not part of the parotid gland. Let's see this. What about the transverse facial artery, retromandibular vein, internal carotid, facial nerve, superficial temporal artery? 31st one. This is a part of the parotid gland, of course. Retromandibular vein formation also, transverse facial artery. Retromandibular vein, yes. Facial nerve, yes. Superficial temporal artery, yes. Now, what is that is not inside is the internal carotid artery. Internal carotid artery is absolutely, not part of parotid gland content. It's not a part of parotid gland content. Internal carotid artery is inside the sheath. It's inside the carotid sheath. So it is not a part of the parotid gland. So remember that the answer is C. Okay, the incorrect one we have to pick, that is C. Next one, coming to the 32nd one. So 32nd one question. So let's see here. Which of the following statement is incorrect? Which of the following statement is incorrect here? So we have to pick the one which is incorrect again. And let's see, the sphenoid bone is what they're talking about. Sphenoid bone. It forms a boundary for which cranial fossa? So it forms a boundary. That's what they are saying. It's talking about boundary itself. Yes. So let's see the anterior cranial fossa. Is it part of the anterior cranial fossa? Yes, it is anterior cranial fossa boundary because lesser wing is the boundary. Foramen spinosum. Yes, it is. Greater wing comes there. That is where you see the foramen spinosum. Posterior nares. Yes. This is also yes. This is also yes. What about the stylomastoid foramen? Is it part of the sphenoid bone? No, it is part of the temporal bone. It's part of the temporal bone. Next, coming to the posterior cranial fossa. Posterior cranial fossa also has the part of the sphenoid bone because you have the last portion, the body of the sphenoid. Lies in this. So the answer here would be 32. The answer would be stylomastoid foramen. That is the D. So it is not a part of this bone. So D is the incorrect one. Next, let's see the 33rd one. So 33. The chief peculiarity of the first cervical vertebra is. What is the chief peculiarity of cervical vertebra? So here, the cervical vertebra has many features. The first cervical vertebra has what features? So that is the key thing. The moment you see that, you will be like, oh, where is the body? The body is missing. Okay, the body is missing. So that is the thing. So any vertebra will have a body, right? It will have a body and then it will have transverse process. It will have tubercles, and then it will have, if cervical vertebra, it will have the foramen transversarium. But here the main key thing where we imagine the intervertebral disc to be present, that itself is missing. The body is missing. So here I would say no body. So this is the one I would say C. So the answer here is C. So biped spine, of course it is there. That is there in all other things. But first cervical does not have the body. The rest, all of them have body. Okay. No vertebrae atrial foramen. That is the foramen transversarium. No transverse process, no posterior tubercle. Okay, fine. All this is fine, but the no body is the main thing. That is the striking feature of first cervical vertebra. And let's go to the 34th one. 34th question. What do we have in the 34th question? Is there anyone who is juggling and struggling with any question? Not understanding the question? Is there anybody? You can post your queries there. Okay, let's move on. If that is so, let's move on. Okay, so now here the 34th one. Which of the following statement is incorrect? Now here again we have to pick the one which is incorrect. Remember? So let's change the color of the pen for our own, happiness. Let's see if some colors make us really happy. I'm going to pick purple and let's move on with the 34th question. The soft palate. Soft palate is the key word. Now regarding soft palate, which one is incorrect? It has many salivary glands, 34th one. Soft palate has many salivary glands. Of course, it has got von Ebner glands surrounding it, and it has those salivary glands which are mucus secreting. Some of them are unnamed salivary glands. All this are present around the soft palate. So it is true. It contains tendinous part of the tensor very palatine. Yes, it has the tendinous part which is attached to the crest, palatine crest. Okay, palatine crest. So that is their tensor belly palatine. Next, it has stratified squamous epithelium on its upper surface. That is true, same as the oral cavity. Same as the oral cavity. Same epithelium because it's inside the oral cavity. Why would it be a different epithelium? So the oral cavity, the tongue, the soft palate, they're all lined by, including the tonsil is lined by the same epithelium. The tonsil, tongue, the buccal mucosa, and also the soft palate outer surface. They're all upper and outer surface. They're all lined by same epithelium. Okay, so now here we have the same thing. And next one, it is devoid of lymphoid tissue. It is devoid of lymphoid tissue. Is it devoid of lymphoid tissue? 34th one. No, it has lymphoid tissue. If you take a section of, the soft palate, you will see that it has lymphoid tissue. So this is not the correct answer. This is the incorrect one. In histological sections, when you check, there is aggregation of lymphoid tissue here. It receives branches of glossopharyngeal nerve. That is correct. So this portion also, remember we talk about the deviation of the soft palate from the midline. All that when we check, and posterior 1/3 of the tongue. Posterior 1/3 of tongue is by glossopharyngeal. So when we talk about all this, we talk about the soft palate as well. So this is also correct statement. The only statement that is not correct is G. Okay. Next, let's go to the 35th one and see what we have. 35th has, which of the following statement is incorrect again? Here we have to look at the thyroid gland and see what is the statement that is not correct. Thyroid gland is the keyword. So here it enlarges during pregnancy. Is that a correct thing? Does it enlarge during pregnancy? Yes, in some people it does. So going by statistics, yes, it does enlarge during pregnancy. And some of them even, end up having goiter, and even they end up having thyroid issues later on. They may have no isthmus. Yes, absence of isthmus is also there. Sometimes there could be an accessory thyroid tissue, or sometimes there could be a pyramidal lobe. All these are some of the anomalies, or you can see variations in the thyroid development. So this is also correct. 35th one may include ultimobranchial tissue. Yes, that is also be present. It may be entirely lingual thyroid it is called. It starts from, if this is the tongue, there is a line that is called sulcus terminalis, and behind is the posterior 1/3. This is anterior 2/3. And what is this point called? That point is called the foramen cecum. And here is what the diverticulum starts, and it becomes bilobed, and this is the lobes of thyroid. And it is in the neck now. Sometimes it does not move from this point at all, the thyroid tissue. It just stays there and develops as a bump over the tongue. And that is entirely lingual. So it is called lingual thyroid. So it could be a possibility. Then the next one, it is overlapped by thyrohyoid muscle. So only up to hyoid, thyroid to hyoid. So now thyrohyoid is where? From thyroid to hyoid. So it is not overlapped by thyrohyoid. So that statement is not correct. The thyrohyoid muscle is the lateral one. It is not overlapping anything. There is a gap between them, and you can also see there is sternohyoid before that, and then comes the thyrohyoid. So this is not the correct answer. This is the E. Okay, E is the wrong answer or incorrect statement. Next. Let's move on to the other one. 37th one, the mandibular nerve supplies. The 37th one, the question is mandibular nerve supplies. What does it supply? It supplies all of them but one. Which is that one? We have to pick the odd one now. Does it supply rhizorius? Does it supply skin of the chin? Yes, skin of the chin. Remember, not angle. Angle is supplied by great auricular. You see the word auricular. This is chin. Chin, yes. So it supplies the chin. Then mucous membrane of the lower lip, it supplies. Then what about lower teeth? Of course, anything here, it supplies. TMJ, it supplies through which nerve? Auriculotemporal. So all of them are correct except one. One is rhizorius. It is supplied by facial. So it has not got anything to do with this. So answer is A. A. It is the incorrect statement. Next one. All right. 38th one. Let's look at the 38th one. Damaging the right. This is just two statements or keynotes that you may want. There is no option. There is no other statement. It's just the fact that you have to know. So here it is the damaging the right sixth cranial nerve may give diplopia on looking to the left because the abducent nerve supplies lateral rectus muscle. So diplopia or double vision. Okay. Next one. Damaging the ansa cervicalis may give meiosis. Meiosis, that is constricted pupil. Because the dilator pupillae is supplied by sympathetic nerves which run from the superior cervical ganglion. Running from the superior cervical ganglion. So this is the fact. You have to remember this. And with this, we come to the conclusion that we are at the end of this session. And let me also give you a little more glimpse of what else we have. We have some important, instructions to tell you. Before that, let me just give you some information about myself as well as an educator. So here is gross anatomy. We were watching brush up with brush up, and then we were watching this number 3 session, and here is my credentials. You can see I have my MD from KMC Mangalore, PhD from Savita University, and also some of the degrees MT and MBA I have acquired from the USA, Georgia. So with all these, I have worked about 9 years in USA and also working here for past few years. And this is my profile, and these are some of the dedications done by students. And this is something like a keepsake because whenever students dedicate, it is their hard work. So they have put in so many minutes of their watch time, and then they have decided to dedicate these hats to an educator. So all these hats are hard earned by them. So you can also do so by watching those, keeping those minutes, and see how many minutes of good education you have got. So all that you can dedicate to your favorite educator as well. So that's my profile with the number of followers, which could have almost been doubled. And you can also see there is a Telegram channel, Let's Crack NEET PG. You can join this, and you can also join Anatomy by Dr. Rohini, where we discuss a lot of other, clinical oriented pictures. We do see a lot of MCQs, and I do post every day a lot of questions so that you can, interact more and you can definitely develop interest in the subject. So that is one thing. And you can also see that there is plus an iconic courses which is really available, and iconic comes with the PrepLadder access as well. So try all this, and you can also see there is a option where you can ask for a doubt. If you have any questions, doubts, you can definitely ask by clipping the question itself. And here is the special class on September 1st. And please do join it starts as early as 8 a.m. There is 2 p.m., 7 and 9 p.m. So all these you can just block them, and you can also see the special class features you can see, and all these features are really nice because it is special class is much more interactive than the YouTube classes. And you also have polls where you can check the or assess the students, and raise a hand feature is there is you another way of appreciating special class would be you always get a notification prior to the class, and also you can download the PDF notes, and anytime anywhere you can watch. These are some of the steps to the subscription, and this is how you install. And you can also see that there is a Bucks Bounty feature, which where the opportunity is given for the learners to report anything that is very inappropriate. And you can do that by checking this out. And also we urge you to subscribe, like and share our Unacademy Learners app. And you can check out all the other options that you have by downloading the app. So you download the app. First, you just download the app from the Google Store or the Play Store. Then you go to the competitive exams. You just move to the NEET PG section, and under NEET PG, it will ask you for a code, and use the code ROHINI10. So when you use ROHINI10, Rohini 10, when you use that, you are part of the Unacademy troop. So here you are going to get notification about all my classes, and not even a single class you'll miss because you're already registered. By registering, so you will be able to get the PDF notes also. So that is one way of completely making use of your registration. So by downloading the PDF, not just anatomy, you can access many things with this code. So please try this, and when you are happy and satisfied, you can also go for the subscriptions. Subscriptions will give you complete curriculum in and out. So when the demos are going to be this good, just imagine the subscription classes, how it could be. It could be even more better, and there is absolutely no room for any failure. So try this, and here is the renewal code ROHINI10, and you can see this, you can get 10% discount, plus subscriptions, iconic subscriptions, and also batches starting on 18th. That is, you can see, and you can also see there is NEET PG 1 month package that you can check out. And this is QBank series, about 25,000 questions. You can check it out. These are some 12+2 limited time offer, and 4-year subscription is what you can go for, 60,000 and 75,000. So this is a really interesting one because you get 4 years subscription with this. You can also see there is a EMI option as well. So with the EMI, you will be able to definitely, make it pocket friendly because you are paying in installments, and minimum of 6 months is what we are looking at. So when you have 6 months subscription, you can go for the EMI. You can also see there is grant test series, etc. So all that dates you can block and keep yourself prepared for the exam, just like how you would prepare yourself for any exam with the latest pattern. And when you go for EMI option, please don't forget to use the code ROHINI10. So with that code, you will be able to access anything, be it free or be it subscription based. All right, with all this, I'm Dr. Rohini, YN, and signing off, and see you all soon in the evening at 10 again with the more MCQ.